So, everyone on this call, you are welcome. Thank you very much for joining us in our bi-weekly webinar. Today we are going to have a guest speaker from Euclid University, the Gambia, who is also a member. Is going to talk on the topic artificial intelligence in healthcare, which is a very important topic. So this is just the agenda for this webinar session. Welcome address. It is going to be by the president of Pharmacy Scholars Initiative, and then it's going to be moderated by Dr. Safiya Borodo, this session. So before we commence, Dr. Borodo, I will hand over the program to you, but before them, I would like to invite the president of Pharmacy Scholars Initiative to give us a welcome address. And then Dr. Safiya Borodo, you can take over from there and invite the guest speaker. So Dr. Borodo, you can now go to the first slide so that the president will give the welcome address.
Okay, back to the first slide.
All right, can I go ahead?
Yes, Dr. Ibrahim Jato is the president of Pharmacy Scholars Initiative. The floor is yours. Go ahead, sir.
Just 1 minute, please.
Okay, so before you come up, like I said, Dr. Ibrahim Jato is the president of Pharmacy Scholars Initiative, and these bi-weekly webinars are being carried out by...
I'm back, sorry.
Okay.
Apologies, please. It's something that, I'm at work at the moment. So
All
good
right.
day, everyone, and good morning, good afternoon, good evening, depending on your location. From one end is, how do I say, good evening. So welcome to yet another very interesting webinar organized by the Pharmacy Scholars Initiative. As you all know, or for those who have been attending our webinar, or for those who are joining for the first time, I would like to use this opportunity to tell you a little bit about who we are, what we do, and what today's webinar is all about. So is she following the slide?
Yes.
Yeah.
All right, so the name is Pharmacy Scholars Initiative, and it was originally Young Pharmacy Scholars. And we realized that most of us are no longer young. So in the process of being registered with the Corporate Affairs Commission, the name transforms to Pharmacy Scholars Initiatives. And our own motives is to nurture research ideas, especially in early career researchers. So what we do, who we are, so as mentioned before, we are a forum of research mentorship where we give mentoring to top-notch professionals, commonly pharmacists, in career research and career development. And the forum was founded in 2017, specifically December 1st, 2017, and it is currently registered with the federal government of Nigeria under the Corporate Affairs Commission. And what we do is, the main idea about the PSI is research mentorship. So what we do is we train and we guide our members and the general public, such as you who is watching this, on research mentorship. And then we also give advice and guidance on career development, like how you can move forward in your own career. If you want to go for research, so we guide you on how you achieve more in research, or if you go to any professional area, we always give advice and guidance. We also do research collaboration. So what we do is the mentorship. We do the mentorship by this webinar, by discussion on the forum, and as well as through research collaboration. So we teach practically, like we engage you in a research as we are doing the research collaboratively, and then you'll be using that to teach you practically. Okay, this is how we do this, let's do it. And then we also do community engagement where we give back to the community through awareness. Like previously, we conducted a nationwide and statewide awareness program on drug abuse through local radio in Kano and Kaduna. And this webinar is also part of community engagement that we are doing to share knowledge with the public about current trends in health and research. We also do professional development where we organize a lot of programs within the forum. And today's webinar is part of the overall activity that we are doing in the forum, and we are welcoming you to be part of this program. And at the end of this webinar, I'm very sure you will have something big that you add to your knowledge. Given the caliber of the presenter, he's well-known professional, a pharmacy who has practiced in so many areas of practice. I'm very sure when at the end of the lecture, you will really learn a lot, and you'll be introduced by one of our person. You know who the speaker is. Thank you so much for joining us and the lovely webinar. Thank you so much.
Thank you very much, Mr. President. Just for your information, Dr. Brian Janto is based in Australia, and he's one of the co-founders and the current president of our Pharmacy Scholars Initiative, which we there is we have some announcement before we commence. Please mute yourself to limit background noise if you're on this call, and make your comments in the chat box. That is a chat box. If you have any question during the presentation, you can send your comments, or you can raise your hand so that we will observe you and allow you to ask questions. And then the webinar will be recorded, as I mentioned earlier. So this is for your information, and we record it only for educational purposes so that those people that are not here can be able to listen to the webinar. And then we will share a link where you can provide your name, email for certificates, and then where you can give us a feedback for the presentation. So I will share the link on the chat box in the course of the presentation. So my name is Dr. Auwal Bala. I'm here, I'm coordinating this webinar on behalf of the Academic Planning Committee of the Pharmacy Scholars Initiative. And I would like to introduce the moderator of this session, who is also a member of Pharmacy Scholars Initiative, Dr. Safiya Borodo. So Dr. Safiya Borodo, the floor is yours, please. Thank you very much.
Okay. Assalamu alaikum wa rahmatullah, respected colleagues. Good morning, good afternoon, good evening, as the time zone permits. Welcome to the weekly webinar of PSI, Pharmacy Scholars Initiative. Before we start the webinar, I would like to invite Dr. Saada Julde to give us a citation of the presenter. And the presenter today is Dr. Kabiru Gulma, who is going to present on artificial intelligence in healthcare. Dr. Saadatu Julde, if we are ready.
Thank you, Dr. Safiya. Good morning, good afternoon, good evening, depending on your time zone. So Dr. Kabiru Gulma is a seasoned pharmacist and dedicated public health with a passion for information technology. Beginning his journey at Ahmadu Bello University in Zaria, he showcased his commitment to the fusion of pharmacy education and technology through publications and a column in Pharma News, Africa's premier health journal. His impactful career in the public health development sector includes over 20 peer-reviewed journal publications, currently serving as an assistant professor at Euclid University in Gambia. Dr. Gulma brings his extensive expertise to academia and leads the public health aspect of SDG research at Chandigarh University in India, reflecting his commitment to global research for societal impact. As a dynamic presenter, Dr. Kabiru Gulma promises insightful perspectives on the transformative role of artificial intelligence in healthcare. His rich background at the intersection of pharmacy, public health, and information technology positions him as a thought leader uniquely equipped to address the evolving landscape of healthcare and technology integration. Thank you very much.
Okay. Okay. Thank you, Dr. Judy. I'm sure from this citation, we'll be so eager to hear what Dr. Kabiru Gulma has to share with us today on artificial intelligence in healthcare. So, if we are ready, the floor is yours, Dr. Kabiru Gulma. Thank you.
So you can stop sharing so that he'll be able to share his own slides.
Okay.
Yeah, thank you very much.
Okay.
Yeah, thank you, everyone, distinguished ladies and gentlemen, our esteemed participants, and distinguished guests. A warm welcome to this groundbreaking webinar, which is exploring the transformative impacts of artificial intelligence in healthcare. I am particularly honored to be here before you as we embark on this journey into what seems to be an intersection of cutting-edge technology and healthcare innovation. So together we will explore the potential challenges and ethical considerations in this dynamic and critical field. I want to thank you once again for joining us on this enlightening expedition. Before I proceed, I would like to recognize some prominent persons from outside PSI who had the opportunity to grace this wonderful occasion. The President PSI, you may wish to note that Timi Omole is here with us, and he is the country director of International Association of Public Health Logisticians in Nigeria. Saya, welcome and I thank you for keeping your words. Then we have Dr. Oladipo Akinimade. He's the state director of the USAID Integrated Health Program in Ebonyi State. And we have here also amidst us is Nkechi Ako, who is the Senior Grants and Compliance Manager of the USAID Integrated Health Program based in Abuja. And then we also have Ganiyu Mustafa, who is the Director of Finance and Admin for USAID Integrated Health Program based in Kebbi State. I welcome all of you for making it to this webinar. This is not going to be an academic presentation, and neither is it going to be an in-depth lecture. Rather, we will just explore the manifestation of artificial intelligence in different aspects of healthcare. So I will begin with a popular quote, and which I will also like to end with. This says, artificial intelligence or AI will not replace
I don't have any audio
humans
here. Is
with
it from me?
AI will replace
Okay.
humans without AI.
We missed him briefly, but I think he's back.
Dr. Guma, I think we missed your audio. Is it only me? Can someone confirm?
No, it's not only you. I cannot hear him also.
Okay, so Dr. Guma, if you can hear us.
Hello?
I can't hear you also.
Hello?
At some
Can you
point,
hear me?
yes, we can hear you now.
Okay, sorry for that break in transmission. So I will begin with this slide and I will also end with it. It says AI will not replace humans, but humans with AI will replace humans without AI. So I would like you to ponder around this while we'll go through this presentation, and then we will also end with this particular code. So just remember, AI will not replace you as a person, but someone who uses AI, who is a human like you, will replace you. So as an introduction and outline to this webinar, this presentation will provide an overview of the importance of of technology in healthcare. And we will explore things like the impact of artificial intelligence on healthcare, and we will discuss its various applications, the benefit it brings, the challenges it also brings, and then some ethical considerations in using AI in healthcare. The goal is to understand the role of artificial intelligence in healthcare and its potential to improve efficiency, accuracy, and patient outcomes, because that is the overall goal of healthcare too. So let's just refresh our memory by reminding ourselves what artificial intelligence is. It is the science of making machines that can think like humans. It can do things that are considered smart. AI technology can process large amounts of data in ways unlike humans. Yes, that's true, because the amount of data an AI can process, the humans cannot process it within some split seconds. So the goal for AI is to be able to do things such as recognize patterns, make decisions, and judge like humans. It is just created to make humans work much easier, simpler, and then as much accurate as it can be. So it can also be said to be the capacity, AI is the capacity given by humans to machines to memorize and learn from experience, to think and create, to speak, to judge, and to make decisions. So AI is creation of humans, but it's more efficient than most humans. I wouldn't say it's better than humans because humans created it, but it saves us a lot of time and it makes us more accurate in a very, small period of time we need. So just briefly, what are the three types of artificial intelligence? We have the type one, what is called the goal-oriented intelligence, such as the smart assistants. We do have things like Siri in Apple, we have Alexa, and then some facial recognition software on our phones. If you remember, some phones you can use your face to unlock your phones. Those are examples of a goal-oriented intelligence. Then we have the type 2, which replicates humans, such as the spam filters on email, the drone robots, and supercomputers. And we have beyond human intelligence, and examples include fully automated self-driving cars and humanoid robots. So why do we want AI in healthcare? Uh, there is the need for innovation in healthcare due to increasing demands, and AI can be used to address those challenges. So, what are those demands in healthcare that will warrant the use of AI? So we have issues that have to do with human resource gaps, especially in Africa and Nigeria. We really have enough human resources, to be present at the health facility to make it fully functional. So that is there. AI can bridge that gap. And then there are some financial implications because AI can eliminate some costs that have to do with travel, transporting clients from remote settings, or some that uh, are economically advantaged, to have some artificial intelligence gadgets that can save them time to come to the hospital. And it can also improve medical record keeping practices. As you know, our medical record keeping practices is analog, is offline. I do not think we have 100% records. And then we have some essential services like administrative tasks that we can delegate AI to do. You might all recall some videos going around during the COVID-19 pandemic, whereby people that are isolated in facilities are being served food and medicines by robots to minimize human contact. That's an example of AI. And then AI can also help in optimizing treatments, which is a challenge in healthcare due to many reasons. AI can provide diagnostic assistance. It can also help in personalization of treatments. We will all see this in few slides to come. AI can help in drug discovery and development. it can help in predictive analytics and also automation of administrative tasks, and also can help with virtual health assistance. So overall, AI has the potential to revolutionize healthcare by enhancing its efficiency, its accuracy, and patient outcomes. So from the foregoing, what are the applications of AI in healthcare? Uh, we have already said that AI can be used to enhance diagnostic assistance. We also mentioned that it can be used to personalize treatments of patients. We also mentioned that it can enhance drug discovery and delivery. We also mentioned that it can be used in predictive analytics, to prevent people being sick, and administrative tasks automation, which I've given an example. Additionally, virtual health assistants are becoming increasingly popular in this field. So we will dive, superficially into these areas and see how AI touches each one of these areas. We have the first one, AI applications in medical diagnostics. AI can help in automated medical image analysis. What we do have now, we do have machines that do ultrasound, that do X-ray, that do CT scans, but at the end of the day, it's an expert that interprets those results. So those machines can be enhanced with AI, or some are already enhanced with AI in such a way that as they perform those diagnostics, they can, provide explanations for the results that was output by the machine. So it does save time for the experts in arriving at a diagnosis, but that's not to say that the physician will not take a second look. I know whatever AI does, there has to be an expert that will ascertain that, because AI is not 100% better than human beings. So the physician will ascertain the diagnosis of the AI and will save time and move ahead with a definitive diagnosis of the patient. So still under health monitoring that has to do with diagnostics, we have what we call patient remote monitoring, which entails a patient and a care provider, exchanging data using AI. As you can see in this pictorial, you will see there are two circles there. If I can say, one represents the patient and his home, and the other represents the healthcare professional and the healthcare unit. So the healthcare professional can monitor the patient at home without, the patient visiting the hospital. How is this done? We have what we call some wearable devices that measure health indices of the patients, which we may see in the next slides, that are synchronized or that are connected to our mobile devices like phones and tablets. These devices take vital signs such as beats per minute, such as blood pressure, such as your body temperature, such as calories you've burned, and things like that. And because there is the presence of internet, and then also they have their own data repository, or the cloud as we may call it, the healthcare professional can access that in the facility using their interface, to monitor the vital signs of that patient. So important things are done here. Monitoring of the patient's conditions is being done, and then also the patient doesn't have to go to the healthcare facility. The rate at which patients troop into hospitals is being eliminated, and also in some cases transportation costs from the patient's home to the healthcare unit has been eliminated. So this is a way forward. Still under diagnostics, through health monitoring, we have smart wearable devices. We have mentioned them in the previous slide. We have things like smart watches, we have fitness trackers, we have head mount displays, we have smart clothing, and we have sport watches. And all of these are devices you can wear on your body that measure some of your vital signs. Many of us here have, smart watches. For instance, I have one.
Dr. Gulma, we lost your audio.
Hello, can you hear me?
Yeah, we can hear you now. Go ahead.
Yes, we can hear you now.
Oh. So then there is also an aspect of AI that is telemedicine, and which has to do with also patient monitoring from a distance. Telemedicine has many benefits. It has lower costs because the cost of many things are being eliminated. No transportation costs, no laboratory tests or consultation fees at health facilities. And then it can enhance preventive care. Many people get so sick and admitted or they die from illnesses because those illnesses were not detected earlier on. So AI and telemedicine can help in early, preventive care that will, reduce morbidity among the population. This can improve also access to care because you don't have to really be physically be at the hospital except in some necessary situations. It can be used to reduce the spread of infections and other ailments because of tracking devices that we use nowadays, and then it can provide convenience for both healthcare provider and the patients who are both in their convenient places. Secondly, we have mentioned that AI can assist so much in personalization of treatments. Okay, how is this possible? The first thing we should look at is data analysis. We have said earlier on that AI can analyze vast amounts of data that a human cannot do within a short period of time. Uh, One very important use of AI in data analysis, and particularly in healthcare, is the use is data analysis for electronic health records. You all know that what we have now is an offline version. Our health records are in our files at the facilities. Though some have some form of electronic medical records, but maybe not fully electronic in some ways. So if we employ all these, you think about you having all your records electronically, all your hospital visits are recorded electronically. All your complaints have been recorded electronically. All the laboratory tests and the diagnosis are as well electronic. So this will give the AI an ability to identify trends, the rate at which you come to hospital, you come down with XYZ disease, and the drugs that you take, the patterns of your illness, and also the anomalies. So this will help experts to make better informed decisions. You will all agree that nobody can sit with your file in order to go through all your past medical history within just a few minutes and arrive at any logical conclusions. Patients that maintain the same hospital or those that even wander around different health facilities, they have their medical records scattered, and some that maintain the same hospitals have maybe more than one file. So one might be filled up and the other one might be open. So how can just a physician sit in one time and know all your history and all your records at a go? But AI can help you save time, analyze that data, and give you snapshots of the medical history, the patterns of sickness of your patients that will help you arrive at a decision very fast. So there is also a precision medicine, uh, whereby AI techniques help to explore novel genotypes and phenotypes. The aim of this is that precision medicines include earlier diagnosis, screening, personalized treatment regimes for a patient based on genetic oriented features and characteristics. We all know the role of genetics in treatment and also as risk factor in so many diseases. So AI can help, with that analysis. Having analyzed genotypes of somebody can, give some information about risk factors of that person coming down with a particular disease, and so on and so forth. And also through this personalization of treatments, AI can help make treatment effective. We have seen the first 2 points will give the physician all the information that are relevant to arrive at a definitive diagnosis and also treatment plans. So this, enhances precision because you're going straight to the point without wondering. You may make a mistake in, making a correct diagnosis or prescribing the correct drugs, and the patient keeps coming and going, then only intensified investigation will reveal what's truly wrong with the client. So AI will help in making treatment effectiveness by, accurate data analysis of the patients, and then also by, other analysis such as genotyping of the patient in the AI. So the future of healthcare in AI will be key driver in achieving truly personalized medicine in the very near future. So we have also seen some AI robotic surgery, although I don't know if it is here in Nigeria, but it's a robotic assisted surgery in which a robot, is the one doing the surgery. And as it is, research has shown that it has more precision and enhanced dexterity and also reduced invasiveness and faster recovery. So think about what other nations are doing already with this, and also with no reports of some adverse events so far, although everything a robot does must be closely monitored. uh, this is going to take the healthcare to another certain level. Okay, we did talk about AI enhancing drug discovery and development. So in what ways can AI do that? We have three things essentially here. The first is identifying drug interactions and adverse effects. And how does it do that? For instance, if we say everything is electronic and into some software and into some AI tools, even prescriptions, the AI can help, detect potential interactions between prescribed medicines. I think that's simple, straightforward, and clear enough. And we have AI-driven drug design. This is a very important one. For instance, AI can help you generate models faster. I know to to come to come to a certain molecular structure of potential drugs, you need many techniques, many laboratory techniques, but AI can help you do that. I know how difficult it used to be, to come up with structure of potential drugs, but with the advent of artificial intelligence, that is pretty very is simpler. And then we have chemoinformatics, which is analyzing data sets to optimize drug compounds. This simply means that we have what we call structure activity relationships, whereby you alter the structure of a drug, and then you will see what effect it will have, and so on and so forth. So AI can help you do that faster, but using different laboratory equipment and tests, it's so prolonging, and we're not even sure of the accuracy. Then lastly, predicting drug-drug interactions, that is pretty simpler. And then also, just as in the first point, identifying drug interactions and adverse effects. There are 1,000,001 drugs in this world, and nobody can really boast of saying he knows all the side effects, all the potential interactions and side effects, and so on and so forth. But an AI that has all this information installed in it, and having reviewed any prescription, can actually flag any potential drug-drug interaction. And lastly, accelerating research and development process. Well, that is very important and pretty straightforward. We have it will enhance literature review. We have seen how AI tools have helped in research. We have the novel ChatGPT and many other AI tools that will help you scan different information within some seconds and give you as much information as you need to move ahead. So the days of spending too much time on literature reviews might have been long gone in this generation. We also have predictive analytics for clinical trials. AI can help in designing clinical trials and also for managing the outcomes. That will make it simpler. and then also optimizing drug manufacturing, both the process and then the QA. So the fourth application of AI in healthcare is predictive analytics. We have already said that previously in these slides. Uh, it's just that AI can help to predict and manage potential health conditions, because now a healthcare provider can see monitor patients without the patient coming to the hospital. So AI helps in earlier detection of diseases through various methods, and we've given some examples of that. So AI also has some ethical and legal considerations that must be considered. The first is patients' privacy and security concerns have to be looked into. AI is a machine and not a human, uh, and then it's not just a physician whom you'll be in the room and disclose everything to. With the use of AI now, everything might be on a computer system online, and every other person that has access to that computer has access to every other patient information. So that is a genuine concern. And then there could be bias in algorithms, that is approaches in doing things. I earlier on pointed out that AI is not all in all is not better than humans. It's not erasing humans from their works, but the works of AI need to be double checked by an expert, because some experience for people that have been using AI, for instance, in research and in solving some problem, has shown that there are some limitations of AI, for instance, in making certain calculations and also in giving some level of information. For instance, there are some AIs that will tell you their database dates to only September 2021. So anything after that, they don't know, or they cannot say it. But there are some that are in real time and up to date. But that doesn't mean they don't need to be, checked and reviewed to by an expert. So every work of an AI, there must be an expert behind it, because these are also prone to errors, given that they are humans that also created them. Also, the case of informed consent is an issue that needs to be, looked into, and then accountability and responsibility on the part of the facilities holding patient data. And then there needs to be regulatory frameworks for AI in healthcare, because this is new thing, is just coming in. There should be some regulatory frameworks on using it and also protecting a client's data when using AI. So this is just a case study of how AI was successfully used somewhere in the world. I will just read the slide over. A client approached MPIC, which is a company, with a request to develop a remote patient monitoring solution that will meet his business demands. The client had previously used a third-party patient monitoring service, but it had limited functionality and was not economically viable. So the solution developed by MPIC uses cellular, cellular and Wi-Fi technology to collect patients' health data. After finishing calls around the house or just having a nap, the patient can track his heart rate and blood sugar level with a wearable device, and it sends the obtained data to the healthcare manager. He in turn ensures that the metrics are within expected ranges. If any abnormalities are detected, the caring manager can notify the physician and even send an ambulance to the patient. So this is a clear case study of successful use of AI in healthcare. A person is working in his home and a device, is taking his vital signs, and that is being sent to a facility, and a physician is reviewing, and even if there is need, an ambulance will be sent to the patient. So this is AI at work. So this case study demonstrates how remote patient monitoring can revolutionize patient care, allowing for real-time tracking of vital signs and immediate response to any health concerns. So AI is not without challenges. We've said earlier in our outline that we look at some of the challenges of AI. We have said some already in the course of this presentation, one of which is data security and privacy concerns. Then there is lack of standardization, given that AI is new, is more in the Western countries. Then here we are not even seeing it more of it here. So a lot of standardization needs to be done because it's going to be applied to humans. And we have said there are many security and privacy concerns. And then also, how will AI be integrated with existing systems? It's not just coming, to take over everything at once. For instance, our medical record system, we must at some point make the two of them run together for some time before we can trust AI and then go completely with the AI. And we have everything that we need to keep the AI functioning, like the equipment such as the computers themselves. Do we have stable electricity to power those devices? And do we have internet to ensure that data synchronizes all the time? And these are some of the challenges. There are ethical considerations, which you have said earlier on, and then also potential job displacement. We have said that AI will not replace humans, but someone using AI can replace you. Yes, that's still true, but the number of people required to do a job may be reduced. For instance, if you need 15 people to run, let's say, shift at a health facility with use of AI, that can reduce to 10. That's one of the challenges we should be aware of. So, what are the future prospects? Having said all this, artificial intelligence in healthcare includes advancements in AI, healthcare integration, and potential breakthroughs, and also many wonderful emerging trends. This could revolutionize patient care and lead to improved efficiency, accuracy, and cost reduction. We have seen all these at play in our case study and the explanations that we have done. Cost reduction is there, accuracy is there because of the vast amount of data that can be analyzed, to give a trend, to give, a guiding information to making a definitive diagnosis, and that makes everything looks very efficient. So overall, the benefits of AI in healthcare, we have said that it improves decision making, making it much faster, and it solves complex problems within short period of time. And also it performs high level computations and then of increased accuracy. So all these, lead to what we call, what we've been saying, increased efficiency, enhanced accuracy, and improved patient outcomes, plus cost reduction and greater accessibility of care. AI has the potential to revolutionize the way healthcare is delivered by automating administrative tasks and providing virtual health assistance. So, in conclusion, we have explored the potential of AI that can revolutionize healthcare. We have discussed the applications and benefits of AI in healthcare, as well as its challenges and ethical considerations. And we also highlighted the future prospects for AI in healthcare. Thank you for your time. Please feel free to ask us many questions as you can.
Okay, thank you so much, Dr. Kabiru Gulma, for this insightful and very, very valuable presentation. I'm sure we have learned so much from this presentation. Thank you very much once again. And now the floor is open for questions, comments, and observations. Please kindly indicate if you wish to talk by a raise of a hand. Thank you very much. Thank you. Okay.
Dr. Borodo, let me pass a few announcements before the questions.
Okay, Dr. Auwal.
Yeah, so thank you very much. For participants, if you look at the chat box, you see we have posted a Google form. For our webinars, we do give certificates. So if you are interested in certificate, you can fill in the Google form, and you can also give us a feedback on this webinar, and then we'll send certificate to you. And you can also post your own questions through the chat box. So over to you, Dr. Brodo. Thank you.
Okay, thank you very much, Dr. Auwal. I can see Dr. Julda raising her hand. So, Dr. Saadat, if you are ready, you can ask your questions, comments, or observations.
All right, thank you very much.
Dr. Saadat Julde.
Yes, Dr. Safiya, thank you very much. Thank you very much, Dr. Kabiru, for this interesting presentation. My question is, don't you think that there will come a time that you'll be so dependent on AI that come dormant, like we don't think anymore, so dependent on AI? Thank you.
So do I have the floor to speak?
Yes, please.
Okay, thank you for your question. It's a question that should be a concern to all of us. When this whole idea of AI came, we're all very scared it will mar education, it will mar academic standards, and then there won't be any integrity in research and so on and so forth. But it's a reality that has come and that we have to live with. Is an idea that has come and nothing can stop it. You see, there are many other challenges apart from using AI. Yes, it makes everything so efficient and makes us so lazy and maybe complacent. But I have said something that these tools are not too perfect. For some people that have used them for academic research and for also solving some academic, some academic assignments, you will see that there are some errors here and there. So, except if you are good at the subject or if you are paying attention to detail, that is when you will know all this. So, it's not something that is perfect, it's something that has to be, watched by an expert and then vetted by an expert before, the output it brings can be used. Well, it will make us lazy. For instance, if you ask me to write you an essay or a letter, most of it will be done by an AI. But the information that will be in that essay or letter is something maybe that is, for instance, stereotyped. For instance, you asking me to write an essay on my experience during my university days. How will an AI know my experience in the university days? It will just give me a sketch. I will have to do more of it. So it does make our work simpler. It will make us lazy, but it will make us on our toes again. Because when you keep using Outlook and AI and you're not getting results, you know that you need to sit up and you need to vet every information that you say. If you had the opportunity of maybe asking AI what is the treatment for XYZ, it will, of course, tell you the treatment for this is maybe amoxicillin or Panadol or propanadol, but it will give you caution that it is not a medical it is not a medical expert, and that it gives you answer doesn't mean that the information is correct or that you should go ahead and take those medications. You should consult your healthcare professional. So issues like this are here. They are ideas that the time have come. So we have to, learn how to live with them and then adjust. Maybe better things can come ahead. Who knows? I hope I've answered your question.
Yeah, Dr. Saadatu, I hope your question has been answered as you wish. Dr. Saadatu? Okay. Dr. A as well there. You can go ahead with your question, please, if you are still around.
Assalamu alaikum wa rahmatullah. I was having like 3 questions before, but the presenter actually addressed 2. One, the issue of confidentiality, especially for some disease conditions that even the patients we try to, like for patients with HIV, the issue of confidentiality to them, not only for their condition, but for their well-being even in their society is an issue. But I saw that the presentation actually addressed that. And then the other point the presentation also addressed was the issue of job security, because the first people that came to my mind were the record people. And then, in fact, in the presentation also, they seem to be the key when talking about job replacement. But my third request is how do you think we can integrate this issue of healthcare, especially to AI, especially in healthcare training? How do you think we can effectively integrate it so that we're not going to be too much and people will just be dependent on it and forget about the human and so how can we effectively integrate it? That's the question. Thank you very much.
Okay, thank you for your question, Dr. Wada. So integration is already ongoing. We should begin to see AI as we saw mobile phones. When they came, we just buy them. We don't even read the manuals. We don't go to any certificate schools to learn how to use these mobile devices. Nobody actually teaches us. If we have teachers here and there, we just look for someone that has the same type of phone with us, and then he will put us through. The educational system never recognized that as important enough, to be introduced in the system. But why that was so? It was because it was a breeze at that time. It has come and everyone was having it, and everyone was getting along with it with no complaints. And so also AI, when it came, it just caught us overnight. We just saw it from social media, and we're seeing the applications, and we're seeing how it is used. In some schools, for instance, where I'm affiliated, uh, there are software to detect works that were done by an AI. So the fact that you use AI is not a guarantee that the school will accept it or you will pass. There is a certain percentage of AI work that is not acceptable, and I think in our school is 20%. So we don't stop use of AI entirely because it's an idea that has come and we know it will help you a lot. It may strengthen your idea, it may guide you more, and it can save your time. But whatever you do using AI shouldn't be more than 20% of the overall output. So I think it's being integrated, but in practice, it just comes as it is. For instance, when EMR came, that is electronic medical recording, though as a pilot, it just came like that. I know there will be sponsors, there will be public health development workers that will be charged with that. Usually, there must be a donor for that and somebody who is willing to pay money and sponsor for those systems to be established. So, in establishing those systems, I know many things will come into play, like working with the existing system, working with people that are already doing that work, and then also for sustainability, handing it over to them for ownership. So somehow also at the practice end, something will be done because it will not just come like that to be dumped and for people to use. People must be trained, the skills must be transferred, and then people will get used to it over time. I hope I've answered your question.
Yes, thank you very much, sir.
Okay. Um, Next, Sadiq Gulma, please can you go ahead and ask your question? I think it's like you have a lot of questions today. So
Yes, it was a very interesting presentation. Thank you very much, Dr. Gulma. My question is, what are maybe low-hanging AI technologies that you think we can start promoting their use in our hospitals or local healthcare facilities? Because I'm really interested in seeing how we can just start testing out some of these technologies in our own hospitals around. Thank you.
Yeah, thank you. We have said some of them in our presentation. We have said something about remote patient monitoring. Those approaches don't have to, cost much because some of these devices, people are already having them like smartwatches and other things. The only thing maybe is systems or the software that will run those, and then also for the healthcare facilities to be able to accept and use them because through that you can have access to patients' vital signs from afar. And then secondly, we've kept mentioning electronic medical records. That is very important because, apart from just keeping the record, it is important that when a client comes to the hospital, the physician has an adequate history of the patient, but which is not possible because of the number of people that comes to hospital, for a doctor maybe to spend hours just on your file, studying your history, studying what drugs you are allergic to, studying all the ailments that you've reported to the hospital with. Why not an AI just does that and then maybe gives a summary and the physician can make his conclusion or diagnosis with that? That is also something that we can, strongly advocate to start happening at health facilities. And then maybe importantly, when it comes to diagnosis, we have mentioned like the X-rays, like the ultrasound and approaches like that. They are already done by machines. Those machines are just enhanced with AI software and other things. That after producing those results, they can interpret them. But that doesn't mean they are final. They still need to be affected by a physician, but it has reduced, time for the physician to come to conclusion, and the physician can verify whether the information at all is correct or not. So these are at least three things that we can, that are low-hanging fruits that I think wouldn't cost much, to start piloting in our facilities, especially here in Nigeria. Thank you, and over.
Thank you.
Okay, thank you so much. I think PSI maybe is the meeting host that wants to ask a question. Dr. Auwal, I can see your hand. Okay.
Dr. Ibrahim Jato.
Yes.
Oh, it's the prof himself. Okay.
Thank you so much, Professor Gulma. Yes, I call it Prof. For this very amazing presentation. It's a very timely presentation. Mine is more of additional information, not directly a question, especially regarding, I think, two of the questions raised by Julde and Wada about issue of job. So I would like to share an experience from where I am, and another one is like a report. So to experience, I worked in one of the largest community pharmacy before here, that's in Australia. And one of the systems we worked there is, we call it Consist. Consist is like a robotic system that it doesn't dispense directly to the patient, but the robot is the one that brings the drugs for you. So if somebody brings the prescription, you just scan the prescription on the computer and you key in the system, and the robot will go to the shelves and bring such drugs for you and with the label. So all what you need to do is just to bring the drug and just hand it over to the patient and explain. The machine cannot do the patient counseling, so you have to do the patient counseling. So that AI, and it really worked and is very fast. And to be honest, from the time I stayed there, it is very accurate. Like we hardly had any inaccuracy or any error regarding the dispensing. So we call it consist dispense. So once you bring, most of the prescription normally have like a barcode or a QR code. So once you can scan it with the computer and you direct the robot, then it will quickly it will pick the medications with the label, direction, everything, dates, time, everything. All what you need to do is just to hand over the medication to the patient and tell him how he's going to use it. So that's number one, that's robotic dispensing. So this is another place where AI is displacing human. That's number two is, that's what you call, in the department I work now, because from the pharmacy I moved to the Department of Health. And there's a unit specifically called Virtual Care Program. And this virtual program is a unit, very big unit. They have a director, deputy director, managers. And what they do is they coordinate virtual care in GPs. So most of the GPs, now you don't have to physically go to the GP. At your comfort on your home, you can have a consultation and get your prescription, pass the prescription to the pharmacy, and the pharmacy will send the drugs to your house. So you don't have to go there physically. So in that case, there's so many human jobs in between that the machine has already automatically cut them off. So this is the experience I had. And the other one is a report. Last week we had a conference of Leadership 2040. It's like is a conference that projects or that think about in the 2040 how would the healthcare in in Tasmania, my state, will look like. So in there, somebody shared an experience about in university, in Yale University in the United States, where they are using AI in nurse triage. So if you go to the hospital, in the nurse triage, like the nurse that you will see first is AI. So you tell him what your problem is, and immediately the triage will assist you, and he will now post you to the area that you're supposed to, just like in nurse triage. So it's no longer human, it's a machine, and they are doing it as a pilot to see how like an AI could serve as a triage nursing. So that's the information I want to hear. It's something a little bit scary, thinking about something displacing your job, but it's also like Professor Gulma said, also it's like a prompt to tell you that, so you need to really work hard to invest in yourself, to improve your career, to do a lot of online training, participation in webinars, to improve yourself, so that to change, so that you shouldn't allow the machine to replace your job. You should keep on developing yourself to such that as the machine is replacing the job you are currently up, you already have the expertise to go ahead. Thank you so much, and thank you so much, our presenter and the participants.
Mm. Thank you very much, Prof. Jato. Thank you very much for the additional information. Ibrahim Amidu, please can you go ahead with your question?
Okay. Good afternoon, everyone, and thank you, the moderator, for giving me the opportunity to speak. I also want to thank Professor Kabiru Gulma for delivering such an insightful lecture. Truly, your presentation actually illuminated the profound impact AI is making in changing healthcare, and your expertise truly shone through. Thank you very much, sir. Sir, my question, I'm particularly interested in how artificial intelligence would help in achieving universal health coverage. I'm actually being particular about those in the rural setting. The use of AI actually depends largely on technology, for instance, smart devices. Now, adopting these in rural communities, I don't know how AI would help with that. Please, could you please elaborate more on this concern? Thank you.
Sorry, Dr. Borodo, before Dr. Guma comes up, we have a couple of questions on the chat box. So maybe after Firdausi, we can look at the chat box and read out the questions as well.
Okay, Dr. Auwal.
Thank you.
Thank you. Okay. Dr. Guma, I don't know if you're ready to respond to.
Yes. So thank you, Dr. Amidu, for your kind words and your question. Yeah, universal health coverage is something that needs to be looked into, and especially people in rural communities are vulnerable because they may be hard to reach and they may have economic hardships, accessing care. And as we can see, some of these devices that we use in remote patient monitoring, they may cost a lot. And even if they are cheap, the rural man may not take them as priority for now because, poverty has struck very hard. But what maybe AI can help do maybe is estimating how many people that are not reached by care or that are, difficult to reach. And, that can give decision makers idea of the percentage of population not yet covered. And maybe that will help in making decisions such as making some kind of satellite healthcare facilities that are not, fully fledged health facilities that can handle some minor issues, and for bigger issues, people have to be referred and things like that. So I think this is one way in which AI can help by giving decision makers vital information about who is covered and who is not, and in what way can we come with innovative solutions that can help, to bridge those gaps, because health is the right of every human being. Thank you. I hope I have attempted in answering your question.
Thank you very much. That was informative. Thank you.
Okay, Firdaus Shayo, can you go ahead with your question, please?
All right. Thank you very much, Dr. Goma. I really enjoyed this presentation. Unfortunately, I joined quite late as I was in another meeting. So maybe the question I want to ask may have already been addressed in the presentation, but let me go ahead. So I believe you said there is a low probability of error or malfunction, right?
Yeah.
Okay, so mine is just a question of accountability. In situations like that where there is a consequence, who is to be held responsible and what will be done in situations like that?
Okay. Thank you very much, pharmacist, for your question. Thank you also for joining. So we have highlighted this as one of the challenges, actually, issue of accountability. As you said, this is something that is employed to help our work, but we know it's not 100%, and at some point it can fail us. So developing also some legal frameworks for this has also not been done, and we have highlighted this maybe as a possible challenge. But I will say that maybe if wrong information is given, the person that may be held responsible will be the person that acted on the wrong information, because that information is not final and is meant to be vetted by an expert who should be the sole decision maker in the case of that client. So, but we don't want to say we're holding people responsible so that they are becoming scared using
It
AI, but
discourages, yeah.
ultimately, yes, but ultimately that should be, because we assume your brain is better than an AI. You are a human being. You have many experiences that an AI doesn't have. So you
Yes.
should be the sole decision maker. So maybe until those legal frameworks are done, but I don't think it will be any different from what I've suggested. That is, the person making the overall decision will will just have to be blamed because you acted on that information maybe without verifying. I hope I attempted your question.
Yes, thank you very much, Doctor.
Thank you.
Okay, thank you, Prof. I think we can check the questions on the chat box if we are ready to answer them.
Yes, we can go on.
Okay, now the first question from Haruna James. He said, "Thank you so much, Dr. Gulma, for this rich presentation." Question: how can we measure the accuracy of information generated by AI as it relates to healthcare?
Okay, thank you. Well, thank you, Haruna, for your question. That will definitely be relative, honestly. I can't say there is any measure, but I did mention that people that are using AI tools for education or academic purpose, they do encounter one or two times where information given is not accurate. I personally had an instance whereby I asked an AI tool to give me, for instance, a citation using APA style, and it gave me the format, and it gave me an example. So I realized a mistake, and I said, "But you said that X, Y, and Z shouldn't be in italics. Why did you italicize?" It then, gave an output that it's sorry, it was an oversight. So, things like that come once in a while. That's why I kept saying the person behind the AI or the one acting on the information on the AI shouldn't be just, someone who doesn't have in-depth knowledge about that subject. It should be somebody who is well versed about that subject. For instance, if you are in the lab, you must have good experience in all those procedures. And if you're a doctor, you must, be well equipped knowledgeably, to differentiate between what is right and what is wrong. AI doesn't have another perspective, and which is your experience. You can add, X experience, Y, and Z, to arrive at something. But AI strictly has, the ability to give you output based on the information that was installed on it, or yes, or imputed in it, that can be used to infer, to infer something. So there is actually, we can't say there is anything that we can measure the accuracy of information other than the person also using the AI to be good at it. Thank you. I hope I've made a good attempt.
Yes, you did, Prof. Now, another question again by the same Haruna James. He said, also, I realized that some of the AI platforms, example, Chat, GPT, do not have enough race-specific information and data, specifically the Black race. Don't you think information generated by these AIs may be biased towards us, the Black? That is his
Okay.
question.
Yes, he is right. And we did mention bias in algorithm in our presentation. But there's one thing I do believe. If we are employing this in any healthcare setting, then that AI will have to be contextualized to that particular environment. We cannot bring an AI that is being used in Australia, US, or UK and say we just want to deploy it as it is in Nigeria. We have a lot of factors to consider. We have a lot of modifications to make, and then we have a lot of things to add or to remove from it. So I believe if at all it's coming here, or if we are going to use it here, we're not just going to use a template that is used by another country. We are actually going to modify it a lot to suit our context. So we must have, the relevant information, and we must also have an idea of what we want the AI to do for us before we even embrace it. So in that way, I think that bias can be removed because it is our information, it is our input, and it is everything that we specified and that we stated that was deployed. I think that's a fair attempt.
Yes, it is. Thank you. There's another question again by Modestor Obale Dauda. He said, my question is, could artificial intelligence be used to manipulate patients or influence their decisions?
Well, I do not quite understand what he means by manipulate them or influence their decisions. But what I do know is that there is a shared decision now. Maybe the care provider is not, the sole authority to decide on your behalf. He has to explain whatever it is to you, and then you collectively, arrive at a decision. So that influencing decision could just be maybe the care provider needs to explain the key points about uh, what the patient uh, what the patient is facing. But that manipulation, I don't understand the angle which is coming from. Maybe if he's around, he can give us some more highlights.
Okay, I don't think he's around, but if you're around, please, you can ask your question, express your question better. Maybe you get a better answer. So I think I've exhausted all the questions in the chat box. Firdausi Shawe, I can see your hands up again. I don't know if it is the previous one or you want to ask another question.
Sorry, from previous one.
Okay, so thank you. Then the meeting host. I don't know whether it's an information or a question.
That should be the
Yeah.
chat.
No, it's me this time around.
Oh,
Okay.
That's the chairman, PSI, academic planning committee, Dr. Abubakar Shaban.
Okay, then we welcome the chairman. You can go ahead and ask your question, chairman.
Yeah, thank you very much for giving me the opportunity, Dr. Saada Suljuldi and Dr. Auwal Bala. I've been here all around and followed the wonderful presentation. Thank you very much, Prof. Kabil Gurba, for this educative information. Mine really is just in response or just in response to the last question, meaning how maybe it can influence a patient or something like that. Um, I just want to chip in that whether we like it or not, already AI is influencing patients' decisions. Because, for example, now, like we ask AI questions, we before even visiting the physician, you try to search some key informations, whereby in that you are armed already with a handful of information, and in the just like you mentioned, in the shared decision making, whereby the healthcare professional is trying to discuss with the patient. And then because the patient is already informed, it's different if the patient is not informed at all. So that, in a way, it's a kind of it's influencing the decision of the patient, which in turn also make it a discussion, a collaborative and productive discussion with the healthcare professional. And I think overall, if you look at it, it's a positive thing to know something before meeting the physician, because you are a kind of collaborating, not just being spoon fed. And I think at the whole overall, you'll have better patient outcome. So that's just the point I want to make, because with this gadget, with this, we are aware of this, the watches we wear, the phone we use, and all this information are at our fingertips. We are already influenced, but we don't, in a way, because we are so much used to it. It has become part of our life. We tend to not recognize that some of these things are AI already in us. Thank you very much once again. That's my contribution. Thank you.
Thank you so much, Mr. Chairman, for your contribution. I don't know if Prof. Gulma will want to respond to that.
No, I think he has added enough lights, which I didn't add. That is patients nowadays, they search their conditions, what they are facing before they even go to the healthcare facility. So even the doctor knows that the patient is not coming blank and is coming with some of his biased understanding, I can say. So that is another perspective to that. Thank you very much, Dr. Shaban.
Yeah, Dr. Borodo, do you have more questions? Or
No, I think we have exhausted all the questions. So let
okay.
us not exhaust the Professor Gulma too.
So, thank you so much, Dr. Borodo, for taking us. Thank you. I can see Samaila Hassan. Do you want to say something?
Yes, sir.
Okay.
Good afternoon to you. Thank you, Prof, for your wonderful presentation.
Thank you.
Please, I have this concern, especially for the young chaps coming up, young pharmacists. What advice can you give to them so that they can key into this artificial intelligence and other related issues? For example, when it comes to their master's, PhD, and other researches after their undergraduate studies. And currently, is there any scholarship that pharmacists and other health care related professions can actually key into to see that they have masters related to artificial intelligence? If there is, please kindly share with us. Thank you, sir.
Okay, thank you very much, sir. So the advice I will give them is to actually key into it and to master it very well, because it can save you time and it can give you a vast amount of information that you would have spent days searching on your own and without coming to any reasonable conclusion. In terms of that, I can say AI does an excellent job. Well, regarding scholarship on programs on AI, I believe most AI programs, even if they have fees, is just minimal, because you can find many courses free online. Most are being advertised on Facebook, and I think those are the basics. Those are what we need to be registering and be getting those certificates. It's not a thing to say that you want to go and do a bachelor's degree or a master's degree in AI. Already, whether you've done that or you've not done that, AI has touched everyone now and it's still going to touch. So it's better to, have more knowledge by acquiring those certifications and having those basics, that will also keep you abreast with the current trends and dynamics in the system. So I believe I see most of those adverts on Facebook. Mostly they are nearly free, and even if they have money attached, maybe it's very negligible. So people can just Google, and then I think they will find a whole lot of them. Thank you very much. And over.
Okay, thank you. Abdurrahman Abdullahi, please go ahead and ask your question.
Thank you very much, Safiya. And thank you, Dr. Gulma, for that impactful presentation. Actually, I'm not surprised. Uh, at least I knew you started publishing when you were still a student, so it's not surprising. Um, my question, I think I know some of those questions have been addressed because I have to be in and out of this call because of other engagement, some calls that came in. And that actually prompt my this question. I don't know, maybe somebody have asked and I missed it. Artificial intelligence also is dependent on some other form of mechanisms and technologies. If in a situation where precision is key and it has to depend on other technologies or other mechanisms, how effective could that be? Because while I was on this call, a voice call came in and I'll have to log out, or it will have to log me out. And before I come back, I have to rejoin. So there is break. So if artificial intelligence will depend on other technologies, other mechanisms, how could we be certain that where precision is demanded, these other technologies could not fail artificial intelligence? Secondly, in dealing with humans, you need empathy. You need that emotion. You need emotion. Can we be sure that artificial intelligence will offer that in dealing with humans in healthcare delivery system? Thank you very much for that interesting presentation.
Yeah, thank you very much, sir. Thank you for your insightful questions. I will attempt to answer them one after the other in the order in which you asked them. Regarding precision, in the other tools or software that AI rely on, uh, all we can say is that when things are created, they are not perfect, and they only get better after regular use, after reviews, and after also feedback by users. So that's the only way you can keep improving the precision of those technologies. And I keep saying it shouldn't be sold. Uh, After AI has done everything it has to do, then there should be a sole decision maker and who is the expert in that field. If it is a laboratory, there will be the scientist. If it is a pharmacy, there will be the pharmacist. And if it is the doctor, there'll be the medical doctor. So it shouldn't be sold, and then somebody has to take the final decision and not the AI. And we can only improve the precision by, giving feedback, and that's the only way we get, things getting better. Because when you give feedback and then there are regular updates, we cannot envisage some things until some events happen. And until when they happen, then that is when we learn lessons and give feedback and begin to improve the system. So I think that is one of the ways in which we can improve the precision of this system. And then secondly, regarding empathy, well, a robot doesn't have emotions, and computers also do not do. I had an experience with AI. I was generating multiple choice questions. My instructions were develop a multiple choice question on, let's say, climate change, and indicate the correct answer with justification. So I was developing many MCQs. So I realized a pattern that every time the AI gives me the correct answer, it will be A. So I curiously asked, why is it that every time you return a question, the correct answer is always A? And surprisingly, the AI replied that I'm an AI and I do not have emotion. That is purely coincidental. So only human beings can have emotion. And also, as Dr. Jato has said, robots can do one or two things, can deliver medications to you, but he said that the patient counseling, you have to be the one to do it yourself, because you are the human being and also you are the expert and you are the final decision maker. So that one, we can say that only human beings have empathy. The best AI can do is to use caring words on you. But words are different than seeing somebody's face change because he is empathizing with you. I hope I attempted your question, sir, and thanks for coming.
Thank you very much, Dr. Gulma.
Okay. Thank you, Abdurrahman. I hope your questions have been addressed.
Yes, ma'am.
Thank you, sir. Okay. I think Professor Gulma, there is Mudassir, who asked a question initially, is back again. Maybe he wants to clarify what he wanted to ask. So Mudassir, if you can go ahead. You're probably the last person we're going to take now. Please go ahead. Thank you.
Assalamu alaikum wa rahmatullah.
Wa alaikum salam. Go ahead, Mudassir. We can hear you.
Okay. Thank you, everyone. Thank you, moderator, for giving me this opportunity. So, my question is, like, as you mentioned, the potential concern about the use of AI in healthcare, like it could be used to influence patient decision. Like, for example, AI could be used to provide patients with recommendations that are based on their personal data. So, sir, this recommendation could potentially influence patient decision about their health. So that is why I asked this question about the ethics of using AI in this way. Who should be responsible for the decision made? Like, who should be responsible for the decision made by AI? Like, how can we ensure that patients are not being manipulated by this recommendation? I hope now you understand my question, sir.
Okay, can you come again with the last part?
Okay. Like, sir, as you said, like the potential concern about the use of AI healthcare, it could be used to influence patient decision, right?
Yes.
So, for example, if AI could be used to provide patients with recommendations that are based on their personal data, this recommendation could potentially influence patient decision about their health. So, so now who should be responsible for the decision made by that artificial intelligence? How can we ensure the patient are not being manipulated by this recommendation?
Okay. So I think it's pretty easy. Whatever the AI gives as maybe an output or a recommendation will be discussed with the client by the doctor. The doctor doesn't give you uh, a directive, or he is solely responsible for taking decision about you or the medications you take. So it has to be a shared decision. The client can have his perspective. He can decide to agree, he can decide to seek for more clarification, and he can decide to disagree. So the fact that AI just gives an output or information, that is not the end of it. The doctor will discuss with the client, and the client will have to agree before any other plan is implemented. It's
Dr. Gulma, we lost your audio. If you can hear.
not cut
Kind of fluctuating, breaking in.
on that whatever the doctor says is final, or yeah, a doctor don't mean.
Yeah, we can hear you now.
Okay, so I believe he has said me that the fact that AI gives information is the doctor will study it, discuss with the patient, and they arrive at a collective decision. So I hope I'm clear on that.
Modesta, are you with us?
Thank you, sir. I understand what you said, and thank you for the wonderful presentation. And may Allah reward you abundantly. Thank you once again.
I mean, thank you, and you too.
Okay, thank you very much. I think in the absence of any other question, we can allow Prof to rest. And if you have any other question, you can post it on the chat box so that it can be addressed later. So thank you very much, Prof, for this very, very wonderful and insightful presentation. Dr. Auwal?
Thank you very much, Doctor.
Over to you. Thank you.
Yeah, thank you very much, Dr. Borodo and Dr. Gulma for Dr. Borodo for moderating the sessions and Dr. Gulma for delivering a very insightful and informative lecture. So before I wrap up, I would like to, my name is Dr. Auwal Bala. On behalf of the PSI Academic Planning Committee, we thank every participant for participating in this webinar. And like we said earlier, there is a Google form that we posted on the chat box. If you fill the Google box, you can give us a feedback where you think we can improve. And then we can also send you a certificate to the email you will be providing in that Google form. We thank everyone for participating. We would like to recognize the presence of senior colleagues like Doctors Timi Omole, Oladipo Akimbade, Nkechi Acho, and Ganiyu Mustafa. We appreciate your presence here. And we also recognize the presence of Sadiq Gulma, who I believe is a brother to Dr. Gulma. Sadiq is also someone I
Dr. Auwal?
I think Dr. Auwal, his network is has gone.
Yes, okay.
Yeah, you can complete it, Prof. Unless.
Okay, thank you very much for the presentation. Thank you very much. We appreciate everyone's presence. So in the absence of no comment, no questions, or any other observations, once again, we thank Professor Gulma. I don't know if you have anything to add, Prof, before we round up.
Hello, Gulma, do you have anything to add? Hello, Prof. I think that's fine. Okay, we appreciate the presence of everyone and expect our certificates and the webinar recording and your certificates, your email you provided in the form. Thank you so much, and thank you so much, Borodo, for everything. Bye-bye.
Thank you, Prof. Okay, bisalam. Thank you.
Thank you, Prof. Bye.
Bye-bye.
Thank you. Bye, everyone.